They promised precision, mercy without error, a future where machines would save us from ourselves. But I've seen what happens when wires twitch and protocols fail. The fates you're about to hear weren't twisted by hatred, but by systems we trusted too much. Between 2000 and 2013, the FDA logged over 8,000 robotic malfunctions. More than 1,300 patients were injured, and 144 died, often while their surgeons watched, powerless. These weren't just glitches, they were silent betrayals, hidden in software, coded in steel.
Welcome to the Archivist Files.
One body burned from within as the surgeon watched, unable to stop it. One terrifying truth: when the code breaks, it's the body that pays. The operating room hummed with sterile anticipation. Overhead lights bathed the surgical theater in a cold glow, reflecting off steel instruments and the looming silhouette of a robotic surgery system. It was a September morning in 2021 at a Florida hospital, and 59-year-old Sandra Sulzer was about to undergo what should have been a routine procedure to treat her colon cancer. She and her doctors placed their trust in cutting-edge technology, the Vinci surgical robot, hoping its precision would make the operation safer and easier. But the promise of a flawless, minimally invasive surgery would soon give way to an unforeseen nightmare. In the end, the very machine meant to save Sandra's life would be blamed for taking it. Baptist Health, Boca Raton Regional Hospital, Florida. The surgical team prepares for action. At the center of the room stands the Da Vinci surgical robot, a multi-armed device that the FDA had cleared for surgery in 2000. Its four metallic arms arch over the patient like some futuristic surgeon. Each arm holds a different instrument: forceps, scissors, scalpels, poised to cut and cauterize with superhuman steadiness. A few feet away, the lead surgeon sits at a console, peering into a 3D viewfinder. His hands grip joystick-like controls, and as he moves, the robot moves in tandem. The Da Vinci system translates the surgeon's hand motions into precise micro-movements of the instruments inside Sandra's abdomen, guided by an onboard camera. On the table, Sandra lies draped and anesthetized, unaware of the delicate ballet of man and machine about to take place. Small incisions have been made in her belly to allow the robot's slender tools inside. This approach is meant to be less invasive than open surgery, promising a quicker recovery and less pain. Sandra's case removal of a cancerous section of colon is exactly the kind of procedure the Da Vinci was built for. Everything is ready. The room falls quiet except for the beeping of monitors. With a nod from the anesthesiologist, the surgeon begins. Robotic arms come to life, and the operation is underway. At first, all is routine. The surgeon's view, transmitted from a tiny camera inside Sandra's body, is clear. He delicately maneuvers the robotic instruments to cut away the tumor and cauterize blood vessels to prevent bleeding. Nurses and assisting doctors monitor the readouts and swap in fresh robotic tools as needed. The procedure is proceeding smoothly, a testament to modern surgical innovation. No one in the room has any indication that something is about to go terribly wrong. Suddenly, without warning, the technology falters. As the surgeon cauterizes tissue deep inside Sandra's pelvis, a nearly imperceptible spark jumps where it shouldn't. In the span of a heartbeat, a stray electrical arc from one of the robot's instruments leaps to the surrounding intestinal tissue. An invisible bolt of energy, escaping through a tiny crack in the instrument's protective insulation, sears into Sandra's small intestine. It happens in an instant so fast, so subtle, that none of the surgical team sees it. The arc occurs just outside the field of the camera's view inside her body, and there is no alarm, no obvious flicker on the monitor to signal the danger. For a brief moment, one of the robotic arms shudders ever so slightly as the electrical discharge finds an unintended path. The surgeon, focused intently on the tumor resection, doesn't notice anything unusual. The robot's movements remain steady under his control. In the dimly lit depths of the patient's abdomen, however, the damage is done. A charred lesion now perforates the wall of Sandra's small intestine, a serious injury inflicted completely unbeknownst to the surgeon. The Da Vinci robot has just burned her internally, and no one in the room realizes it. Oblivious to the silent injury, the operation continues. The team methodically works toward completion, unaware that with each passing minute, digestive fluids are beginning to seep from the hidden wound in Sandra's intestine. The Da Vinci robot's job, it seems, is finished successfully. The cancerous portion of colon is removed and extracted through a small incision. The surgeon surveys the operative field through the 3D camera one last time. Everything looks clean. Satisfied, he withdraws the instruments and the camera. The robotic arms are disengaged and wheeled back as the incisions are closed. From all outward appearances, the surgery is a success. Sandra's vitals are stable as she's wheeled to the recovery room. The surgeons and nurses breathe a sigh of relief, not knowing that a ticking time bomb has been left behind inside her. In the hours after surgery, a creeping pain begins to build in Sandra's abdomen. What starts as soreness, expected after an invasive procedure, soon morphs into something far more severe. By that evening, monitors are picking up a rapid heartbeat and dropping blood pressure. Sandra awakens groggy and in agony, her belly hardening with inflammation. Alarms sound as her body registers distress. The medical staff rushes to evaluate. Something is very wrong. Doctors order imaging scans and blood tests. It doesn't take long to uncover the grim truth. A scan reveals air and fluid leaking into her abdominal cavity, telltale signs of a perforation in the gastrointestinal tract. The source is soon identified. A section of Sandra's small intestine has a burn hole in it. The very spot where the robot's instrument had briefly touched with that errant spark is now ruptured and leaking bile and bacteria into her sterile abdomen. In that moment, the surgical team realizes this is a dire surgical complication. The mysterious turn of events during the operation has manifested as a life-threatening injury. They rush Sandra back into surgery, this time an open emergency procedure to wash out the infection and repair the burned intestinal wall. The ICU is alerted. Strong antibiotics are started to stave off sepsis. Family members are notified that her condition is critical. Her husband, Harvey, who expected to be taking her home to recover in a few days, instead finds himself staring through the ICU glass at a flurry of activity around his unconscious wife. Tubes and wires now snake from Sandra's body, fighting to keep her alive. Despite the doctor's desperate efforts, the damage has progressed too far. The infection from the unnoticed bowel injury sends Sandra into septic shock. Her organs begin to fail one by one as toxins flood her system. Within a short few days, Sandra Sulzer's frail body can fight no longer. Less than 2 weeks after what was supposed to be a straightforward cancer operation, she is dead, a victim of internal injuries caused by a machine's malfunction. The hospital that had confidently rolled out its high-tech robotic assistant is left to face a horrifying outcome: a patient who never left alive. For the surgeons and staff, it's a devastating loss. For her family, it's an unimaginable tragedy. Sandra was there for a cure, and now she's gone because of a hidden surgical error no one even saw happening. In the aftermath of Sandra's death, grief is compounded by confusion and anger. Harvey Sulzer wants to know how such a tragedy could possibly occur. How did a routine surgery for a common cancer turn into a lethal fiasco? Hospital administrators conduct meetings, internal reviews, quietly acknowledge that an internal burn from the robotic tool was the likely culprit. But for Harvey, private explanations are not enough. He needs accountability and answers on a larger scale. He begins to ask questions, not just of the hospital, but of the maker of the robot itself. What he uncovers is a disturbing pattern that stretches far beyond his wife's case. Sandra was not the first, and would not be the last, to suffer such a fate. In early 2024, Harvey Sulzer files a federal lawsuit against Intuitive Surgical Inc., the manufacturer of the Vinci Robot. The lawsuit's allegations are alarming. Intuitive Surgical knew about the risks of electrical burns and device malfunctions, yet failed to properly warn patients and surgeons. Harvey's legal complaint claims that had his wife been informed of those risks, she would have never agreed to let the robot assist in her surgery. In essence, he says, Sandra was kept in the dark about a deadly danger lurking in the device entrusted with her life. As the lawsuit progresses, a trove of information comes to light. Intuitive Surgical's own records and prior reports reveal that Sandra's case was not a freak accident at all. Similar incidents had been occurring for years. In fact, by the time of Sandra's death, Intuitive was already facing roughly 93 other product liability lawsuits over its robot, many filed by patients who were burned or injured during robotic surgeries. The company had also logged thousands of adverse incident reports involving the Da Vinci system. And among those reports, the most dangerous injuries were the very kind Sandra suffered: internal burns from electrical energy arcing out of the robot's instruments. Harvey learns that the deadly flaw in the Da Vinci robot was traced to something seemingly minor: a cracked protective sleeve on the surgical instrument. The robot's tools have insulated coverings designed to keep the high-voltage current used for cauterizing tissue safely contained. But over time and use, microscopic cracks or slits can develop in these rubberized covers. Intuitive Surgical knew about this issue. According to internal documents and an FDA investigation, those tiny cracks allowed electricity to leak out, to escape or arc, in the FDA's words, into tissue where it didn't belong. In essence, exactly what happened to Sandra had happened to others. The robot's electrified instrument could emit a stray spark, silently burning organs and blood vessels outside the surgeon's view. Stunningly, a 2013 Food and Drug Administration warning letter had already put Intuitive Surgical on notice years before Sandra's operation. The FDA had investigated a spike in injury reports tied to the Da Vinci and concluded that the company concealed information from regulators, secretly recalled defective parts, and ignored known injuries in designing critical instruments. Intuitive did quietly pull problematic components out of circulation, likely those faulty instrument covers, but never fully acknowledged the extent of the hazard publicly. They continued to market the Da Vinci as a safe, state-of-the-art surgical tool. It isn't just legal filings saying this. Journalists began digging as well. An NBC News investigation in 2018 found more than 20,000 adverse events related to the Da Vinci robot had been reported to the FDA over the prior decade, including over 2,000 injuries and 274 patient deaths. Multiple patients told NBC of being burned or otherwise injured during robotic surgeries.
Less blood loss, there's less complications.
The evidence was piling up. For all its precision and promise, the robot had a darker side that many in the medical community either failed to see or refused to acknowledge. Harvey Sulzer's lawsuit paints a picture of a company that pushed its high-tech product into operating rooms across the world without fully addressing these dangers. It alleges that Intuitive Surgical emphasized the benefits of robotic surgery while downplaying or failing to disclose the risks. Training for surgeons was left largely to the company, which had an interest in seeing more surgeries done robotically. In Harvey's view, this was a deadly combination: surgeons who might not be adequately trained, using a device that had known hardware flaws, all while patients were kept unaware of the peril. The result, in Sandra's case and others, was catastrophic. For its part, Intuitive Surgical denies that it did anything wrong. The company has disputed these allegations and is defending against these claims according to its statements filed with the SEC and given to the press. Intuitive points out that any surgery, robotic or not, carries risks, and it cites over 15,000 studies in medical literature supporting the overall safety and efficacy of the Da Vinci system. In a statement, the manufacturer insisted its mission is to help surgeons safely and effectively improve patient outcomes, and that robotic surgery's track record is backed by decades of data. In other words, Intuitive maintains that the vast majority of the time, their robot performs admirably, and that instances like Sandra Sulzer's are rare exceptions, often due to user error or unavoidable complications. Harvey Sulzer isn't swayed by corporate reassurances. For him and for the families of others hurt, the statistics are little comfort. By filing his lawsuit, he hopes not only to get justice for Sandra, but to force greater transparency and changes that might protect future patients from the same fate. As legal proceedings grind forward, each fact disclosed feels heavy with a sense of, if only. If only the hospital had known about the prior problems. If only Intuitive had redesigned the faulty instrument sooner. If only someone had checked that insulating sleeve before the surgery. Perhaps then, Sandra would still be alive. Inside that high-tech operating room in 2021, all the pieces were in place for a medical miracle. An expert surgeon, a state-of-the-art robot, a hopeful patient. And yet, a nearly invisible flaw turned the scene into a horror story. The impact of that single errant spark is immeasurable, a life lost, a family in grief, surgeons shaken to their core, and a community's trust in a technology deeply scarred. Today, robotic surgery systems like the Da Vinci are ubiquitous. By the end of 2023, over 8,600 Da Vinci robots were in service worldwide, 5,111 of them in the United States alone. They were used in about 2.3 million procedures in 2023, everything from routine hysterectomies and prostate removals to heart valve repairs. Millions of patients have benefited from these robots, experiencing smaller incisions and quicker recoveries. But as Sandra's story shows, those benefits are not guaranteed. Each operation carries within it the potential for an unforeseen disaster. Still, the company steadfastly defends its creation, emphasizing the positive outcomes and the rarity of failures. In the halls of operating rooms across the country, the Da Vinci robots continue to whir and click, conducting delicate operations under the guidance of human hands. Technology is only as safe as the humans behind it, the vigilance we maintain, and the truths we are willing to confront. The Da Vinci surgical robot was a marvel of modern medicine until it wasn't. And for Sandra Sulzer, that made all the difference between a second chance at life and a life tragically cut short.